I will say one thing, if you're gonna do surgery, you have to really love it and enjoy it. If I didn't like this would be horrible. All right, so I've been kind of looking forward to this week and also sort of dreading it. It's the first time I've been back on service in a few months. The service is on facial trauma call this week, and I have 3 24-hour facial trauma call shifts in 7 days. So is it gonna be fun? Am I gonna be stressed? Am I gonna be tired? Probably all of the above. So at the very least, it's gonna be eventful. Let's do it. All right, sitting in clinic, seeing a bunch of patients. We've been swamped, but gotten paged 3 times. I'll go see the consults when I'm done with this. All right, guys. So I was in clinic all morning. We had to see a bunch of patients, consults, procedures. So I got paged a couple times, got a big lack. I'm gonna go close that and run back to clinic because we have to see more patients. So I'm running over there now. So the massive laceration turned out to be like just a big abrasion. So not a whole lot to do. I'm heading back to clinic. We have like a bunch of procedures to get done. And then I also saw an abscess, did that really quick. Getting a lot more efficient, which is nice. All right, guys, so I just finished in clinic. It is about to be 5-ish. We got blasted in clinic. So many patients we had to see, and so I was running around. I had 7 consults that are waiting on me. Luckily, one of my upper levels is gonna help me out. He's already seeing a couple at another hospital, but I got some crazy stuff that just came in, so I have to go see that. The day hasn't even started and it's already 5. I'm not sleeping tonight. You know what's crazy? I see all these accidents and trauma from these crazy car accidents, gunshot wounds, and it doesn't bother me. Obviously you feel bad for patients and stuff like that, but just seeing these kind of things, it's cool, it's interesting, and we're glad to help. But I just kind of think about it sometimes, like, wow, I just see this crazy trauma, face wide open, and I don't flinch. That shows I'm in the right field. All these sutures, man. Okay, so we have a case that we have to take to the OR. So I'm setting up the OR right now. It's an intern, it's your job to get everything ready. I'm sort of caught up on all my consults. I have like 3 more outstanding. I've seen like 8 at this point, a couple lacerations, things like that. So, all right, case hasn't started yet, so I'm gonna go get some food. All right, so this is my breakfast / lunch / dinner. Some dry fries and a buffalo chicken wrap from the hospital, but I haven't eaten anything all day. Hospital food is gourmet when you haven't eaten. All right, case ended up not going, so we're gonna do it later, which is great. So I have the opportunity to go to the other hospitals and catch up now. So, all right, got an abscess. I have an eyebrow laceration that's kind of big, and have to still do some post-op checks and anything else that comes in. All right, back in the clean workroom. So I just grabbing some sutures. I'm gonna close a laceration involving the eyebrow. So I'm gonna need some 4-0 monocryl, probably some 3-0 Vicryl, and then fast absorbing plain gut. I could use Proline, but Proline you would have to remove later, and it's kind of a pain and a hassle. You never know if patients are gonna show up for their follow-up. So you can use Proline, but I'm just gonna use fast that's absorbing. So let me go close this. 2 a.m. thoughts from my car. I just saw a patient for an abscess, and it's really one of the things you learn in residency is, and as a provider, it's something you're always gonna do, is you have to talk to patients and you have to meet them where they're at, but you have to be able to be so personable. You have to be able to communicate with them so they understand. You have to show that you care. And it's really hard to do all that at 2 a.m. in the morning, but it has to come from a place of sincerity. Patients will empathize and will understand how you feel as if you show that to them. You can be the best surgeon in the world. You can be the best at like doing whatever procedure, but if you can't talk and relate to patients, people are never going to come see you. You're never going to be somebody that's really well respected. And so try to do that and do it consistently, but it's really hard to do it when you're tired and exhausted and you don't want to be in the hospital for an abscess. Anyways, I'm gonna go shower, try and get some food, and then see if I can get an hour or two of sleep. I'll probably get paged, but if I can get an hour, that'd be great. Because I was actually able to sleep for 3 hours. I'm pre-rounding now, but I'm so happy. All right, rounds are over. I think I had like 13 or 14 consults throughout the day, and then had to manage 6 surgical inpatients. So it's a busy day, busy shift. I'm heading to our craniofacial clinic now, and then in the afternoon I have another clinic to head to, but very busy, but I was able to manage. All right, running over to clinic now. Got a minute or two to get there before it starts. It never ends, it never ends. All right, it's lunchtime, so I got myself a sausage, egg, and cheese. Finished at craniofacial clinic, now back at our outpatient clinic. Time to do 500 extractions, 200 consults. I'm definitely over-exaggerating, but not really. Literally been here for, I guess, 3 hours since clinic closed, just trying to write my notes. I'm so fried, my brain is so fried, I can't think. So like I'm typing so slowly, and I had so many notes from the past couple of days that I had to just get done, because tomorrow I'm gonna have another round of notes I'm gonna have to do. We have our conference tomorrow in the afternoon. We have a case that I'm gonna pre-op and go to the OR for. And then we also have another outpatient clinic that I'm gonna be at in the morning. So it's just gonna be way too hectic. I'm post-call, had a clinic all day. It's now about to be 9. I'm gonna go home, try and get some sleep because tomorrow's gonna be another busy day. Okay, I lied. I'm not going straight to bed. Reading a little bit on scapula free flaps and some other things, just to like make sure my knowledge base is just, at least I have some idea of what I'm getting into. And then I'll go to bed. Okay guys, another day. It's Wednesday, heading to clinic now. We have a virtual like pathology session. Pathology is something that is like necessary and required for residency programs to do. So there's like a certain number of lectures and hours and stuff you have to do. So we have a path session in a few minutes. Going to start in clinic in the morning, then I'm gonna go to the OR. I feel a little rested. I didn't get a whole lot of sleep, but enough to get me through this day. So let's see how it goes. Back, gotta get some gloves and gowns for the team. All right, getting ready to scrub in. Got all the stuff you need here. Make sure you have your mask on. All right, case is over. Have to run over to conference. I'm late, so.
And the others, the daughter says that.
I ain't seen nothing. Matter of fact, I'm blind in my left eye and 43% blind in my right eye.
Just finished that grand rounds. We had a pathology quiz. I probably got like half of those right. When you start looking at the histology slides, you have to look for key features, and my brain is also fried, so I probably didn't do all that well, but learned a lot. I come in here sometimes to reflect and reminisce on my younger days when I used to play basketball for fun. Now that I'm in residency and even in dental school, like my first year of dental school, I used to play basketball all the time. I used to play like every day in college, just runs with friends, and it was super fun. But now that I'm in a position where I actually have to use my hands, like these contact sports, you can't really do anymore. You can, but you're at risk, right? Because I need to use my hands to be able to practice. I need to be able to do what I have to do. So you have to be careful about like what kind of activities you engage in. So I've kind of quit basketball, unfortunately, but also it's a very intense sport. Like it can hurt your back, your knees, your joints. So I think it's good. Just lift weights, run, swim, things like that. But I do miss it. right, guys, had a scalp laceration, repaired that. I've actually had quite a few of these my last face call shifts. It's kind of interesting. Scalp and ear lax, a lot of those. So I'm about to head to our clinic. I'm gonna have to do a bunch of post-op checks. We have 3 ORs running right now, so I'm gonna have to check on all those patients. So hopefully it staggers so that I don't have to do it all at once and they stagger and like finish at different times, but I'm probably gonna end up doing a bunch of them from like 7 to 10 p.m. This week has just been very crazy and hectic, just back and forth every single day, sleeping not a whole lot. And it's not just me, it's like our whole service right now. It's probably been the busiest week of the year. My co-residents were all like just kind of hanging in there, but it's been good. It's nice to know you have really great co-residents, people who can help you out in times when you're stressed, and we're all kind of in it together. So that's really great, and that's one thing I love about my program. So shout out to them. Whew. Oh man, it is hot. All right, clinic is over, so I'm gonna head to do my first post-op check. Most likely some trauma is gonna come in, so let's get this started. Luckily, these hospitals are connected, so I'm running to do my last post-op check. Got paged about this patient, so I actually have to go and see the patient in a very timely manner, so I'm kind of speed walking over there. But after that, just got like 500 notes to write and to catch up. What happens when you get 4 consults at 4 a.m. and you have to round at 6:15. I made it on time. I'm sweating. I still have to go back and see 2 other consults before we have clinic at 8 a.m. So I don't know. We'll get it done. Finished morning rounds. So we had to round at one hospital, and I got like 3 or 4 consults between like 4 and 5:30. There was 2 lacerations, one on the lip, one on the forehead. And then we had a motor vehicle accident, and then I had an abscess as well, like all within an hour and a half, and I had to round. So that's like, this is the worst time to get consults, honestly. Like, I'd rather get consults at 1 a.m. than at 4 or 5 a.m. because you have so much stuff you have to do in the morning. So I'm gonna drive over to our clinic, our outpatient clinic, because we have some patients to see. So yeah, it was rough, but made it through. Guys, I just finished. I was so tired at the end, just writing up my notes, trying to finish up everything. It's 4 o'clock now, so I'm gonna go head to get a haircut and then head home so I can crash. Alright, well, that was a week. I honestly don't even know how I got through the week. Basically, this was the fastest and slowest week I've ever had in residency. Like, every day I was constantly doing something, I was constantly busy, but it also felt like it was taking forever because I was so busy and overwhelmed. But the crazy thing about it is I also really enjoyed it. And I might have mentioned this earlier, but if you don't enjoy what you love, if you don't enjoy surgery, this kind of stuff is not gonna be for you, right? These long nights, you're constantly seeing just crazy trauma that comes in, a lot of notes and stress, but if you do enjoy it, this is like an environment where you can thrive in. And I really kind of reflected on that this week. All right, so basically, the past 2 days especially have been very busy. So I was on call Thursday, 24-hour shift. I was only able to sleep about 30 minutes. And then we had Friday, which I wasn't on call, but we had clinics. It wasn't as busy as it normally was, at least the clinic I was at. So I was able to kind of slow down a little bit, but in slowing down, I was so tired, I could feel myself dozing off. You run on adrenaline in these kind of scenarios. Like, you have to get stuff done, so you're gonna get it done. I caught him yesterday, late afternoon going into the evening, and I wanted to doze off for like an hour to 2 because we had a residency program event that I wanted to go to, but as soon as I hit the bed, I closed my eyes and I didn't wake up until 7 a.m. this morning. So basically slept for like 11 hours. So some of the trauma I've seen, like we had gunshot wounds, motor vehicle collisions, bunch of lacerations. I don't know how many lacerations I did this week, which is probably the most fun you have when you're on call is lacerations. Everything around the laceration, like getting it set up, notes and stuff, is not fun, but doing it is really fun because I think it really tests your skills, especially with the aesthetics, because we're working on the face. So if you get a laceration on your arm, it's all about closing it. Obviously you want to do a good job, but when you get a laceration on the face, it really matters. So what you do in that short amount of time is really important for that patient's aesthetic outcomes. If somebody has a cut on their forehead, they could have a scar for the rest of their life. You want to do the best job possible. So it's really forced me to make sure I am practicing and doing well with that stuff. And I could see myself getting really better with this. So that's really good. Tomorrow we're on call, or I say we're on call, I'm on call. You guys are just watching me. And then we are done with facial trauma for this week. All right, Sunday, going to the OR, just finished morning rounds. We got a trauma that came in. Got these big balloon hospital scrubs because they're out of my size. Done. Another one. All right, I'm sitting in the OR waiting for the patient to be rolled back. We got a facial lac with a lot of debris, so I have to do a washout, debride the wound, and then close the lacs. So I'm gonna do that. So the OR case is done. I have like 6 consults pending. We just got another trauma that came in, so I gotta go see it. And then still got to do a couple of post-op checks, so it's just busy. All right, so it's 10:30. I'm gonna go do my 2 post-op checks. I'm going to go see a lip laceration, and then I have to go take a look at a trach. We're rounding at 6:45 a.m., so I got to be there. All right, I was gonna go see a patient and check on a patient, but it's raining outside and it's like a tornado. So I'm just gonna sit in here and try and write my notes until it stops, but I might be stuck here for a while. All right, gonna take a quick nap before morning rounds. I got like an hour, so I just need to close my eyes for a little bit so I can make it through the rest of the day. All right, guys, I made it to morning rounds. I finished seeing all my patients. I'm not gonna head to clinic, but the call week is over. I'm so happy, so thankful. So glad it's done, because that was a week. That was something. But I'll check in with you guys a little later. All right, guys, it's Monday. It's 6 p.m. Just finished in our clinic. I'm gonna head home now. I'm completely done. So my call shift ended at 7, but I had clinic, so it's a light clinic day. Wasn't too busy, and I was able to get like 2 hours of sleep yesterday. So I feel pretty good. Luckily, I'm not on call the rest of this week, which is really nice. This has been a rough week. I learned a lot this week. Honestly, looking back on it, I survived and we got a lot done, a lot accomplished, and I've learned a lot. So I think it'll only benefit me in my journey in residency. But yeah, that is a week with 3 24-hour facial call shifts. I wish I could have recorded more. There's just so much going on, running back and forth, seeing patients. Like, there isn't time to record everything, but trust me, it was a lot. So thanks for watching. If you watched this far, like, share, subscribe, share, and I'll see you guys in the next video.